Hello, my name is Helen Outhwaite and I'm a Macmillan Urology Clinical Nurse Specialist. This video is aimed at those just finishing or on long-term prostate cancer treatment and contains some advice and guidance to support your well-being. Prostate cancer treatments affect each man differently and you might not experience all possible side effects. Those you do experience can be difficult to manage. Here are some steps you can take to help with some of the more common side effects. Treatments for prostate cancer can cause urinary problems such as leaking urine, needing to urinate often, sudden urge to empty your bladder, burning when urinating, difficulty urinating, blood in your urine. Urinary leakage is more common following surgery. Most men start to see improvement within 1 to 6 months following surgery. Some men take longer or never fully recover. If you are experiencing mild urinary incontinence, you may be able to control it by learning some simple exercises. Pelvic floor muscle exercises can strengthen your control over your bladder and would be beneficial to start as soon as possible following treatment. Needing to urinate often is a sign of bladder overactivity. A simple way of trying to help is bladder retraining, learning ways to train your bladder to hold more urine. You start by holding on for a few minutes when you need to pass urine. You can gradually increase this by a few minutes each time. You may find it easier to distract yourself, such as reading. Prostate treatments such as radiotherapy can cause pain when passing urine, known as radiation cystitis. You can help these symptoms by drinking plenty of fluids and the right types of fluids. It is advisable to try and drink 1 to 2 litres of fluids a day. Try and avoid drinks that irritate the bladder, such as alcohol, caffeine, fizzy and acidic drinks. Try to avoid going to the toilet just in case, stop smoking or vaping and keep to a healthy weight. We encourage keeping physically fit and to avoid constipation. It is important that if following these simple steps you are still experiencing bothersome urinary symptoms, that you contact your health professional. They may recommend further treatments such as medications to help with your symptoms. It can be difficult to talk about your sex life and problems with erections, but do not let embarrassment stop you from getting the information and support that can help. If you identify as gay, bisexual, transgender or LGBT+, you may worry about your healthcare team treating you insensitively. Having your sexual or gender identity acknowledged may help you feel more supported. Prostate cancer treatment can cause erection problems, changes to penis size and shape, changes to orgasms, desire for sex, your libido, having children and loss of sensitivity. If you're experiencing erection problems, it is likely that your nerves have been either partially or fully removed following surgery or are damaged due to radiotherapy. Most men find it difficult to get an erection strong enough for sex. It can take anything from a few months to years to return and they may never be as strong as before. In some cases, particularly after radiotherapy, some men's erections can get worse over time. It may be possible to treat you with a type of medicine called PDE5 inhibitors. PDE5s work by increasing the blood supply to your penis. The most commonly used PDE5 is sildenafil, otherwise known as Viagra. However, there are others available if this is not effective or appropriate for you. A device called a vacuum pump, a simple tube connected to a pump, is encouraged to be used in addition to medications as a rehabilitation for your penis. Changes to your body and sex life can have a big impact. It is important to find a solution that's right for you and to ask for support when you need it. There are alternative specialist services available to support men and their partners with erections and intimacy issues. Fatigue is a feeling of extreme tiredness that doesn't go away, even after you rest. It is very common with men with prostate cancer. Around 3 in 4 men with prostate cancer will experience fatigue. We don't know exactly why men with prostate cancer experience fatigue. It is likely that lots of different factors are involved, such as prostate cancer itself, treatments for prostate cancer, stress, anxiety or depression, travelling to appointments, symptoms of advanced prostate cancer, pain or pain-relieving drugs, other health problems, not sleeping well, lack of physical activity. There is no one solution which will resolve fatigue, but there are lots of things you can do to improve or manage it, such as physical activity, plan ahead and take things slowly, seek help with emotional concerns, ask for help, make time to relax, eat and drink well, sort out your sleep, and complementary therapy. It could be useful to speak to your specialist nurse or GP. They may look at the causes of your fatigue and suggest some interventions which may help. You may experience mixed emotions when receiving and beyond treatment for prostate cancer. It may take time to recover, and long-term side effects can have a real impact on your daily life. There are some steps you can take to help manage them. Even if you already have a healthy lifestyle, you may choose to make some positive lifestyle changes after treatment. Making small changes such as giving up smoking, eating well and keeping active can improve your health and well-being and help your body recover after treatment. Some complementary therapies can help with the side effects of hormone treatment, and you can find out about these via your local cancer information and support service. Red flag symptoms are changes to your well-being that you may notice, and we would like you to be aware of what they look and feel like. These are leg edema, blood in your urine, progressive fatigue and bone pain. If you think you have any red flag symptoms, it is important that you take action. So please call your clinical nurse specialist and let them know. Mention when the symptoms started and how regularly you are noticing it. If you leave a message and no one calls you back, then call again. If in doubt about anything when recovering from cancer treatment, it is important to reach out to your clinical nurse specialist or GP for advice.
I'm Steve Pattison, I'm 58, I work as a Health and Wellbeing Officer for Harrogate Town Community Foundation. I found out in September 2022 that my PSA was raised and I was diagnosed with prostate cancer in October 2022. I think because the word cancer is used, the initial reaction is just utter shock, and then you have to try and process that and just take each step as it comes. I looked at the options that were offered to me from the nurses once my diagnosis was confirmed. So the course that I'm on is radiotherapy with a mix of a hormone treatment. With the support I've got at home, the support I've got at work has made my day-to-day life easier. I got all my work colleagues together and I explained the situation I was in, the journey I was on. I don't need sympathy, I just want people to know. And I did the same in all the programmes that I'm involved with through Harrogate Town. On the back of that, they've gone off and got tested. Finding out I've got prostate cancer has given me almost that kick up the backside to have a real good look at myself and think, get back on track with one or two things. I've got back into a more healthy way of eating. That's not to say I don't enjoy myself every now and again, but everything in moderation. But don't shy away from fitness. Going out for a walk is brilliant. The advice I would give you is talk. Seriously talk, because a problem shared really is a problem halved. If you've got that strong mental attitude, which comes from just being open, honest and talking about it, it's going to help me on the journey that I'm on at the moment.